The whole program started with the vision of two people who were playing tennis in Hyannisport, Massachusetts. Eunice Kennedy Shriver and Dr. Robert Cook, who was chair of pediatrics at the Johns Hopkins University. Each said they were beating the other one. I actually believe Mrs. Shriver, nobody could beat Mrs. Shriver. But they finished the match, and Dr. Cook said, you know, if you're going to move people out of institutions and into community settings, you're going to have people who know how to provide care in that new environment. And out of that tennis match came the idea for these university-affiliated facilities. The Mailman Center was one of the original 11, and the University of Miami started with the Mailman Center as it opened in March of 1971. In attendance that day was, of course, Mrs. Shriver, Senator Ted Kennedy, and our keynote speakers were Dr. Jean Piaget, the famous Swiss psychologist, and Dr. Uri Brafenbrenner, one of the faculty from the psychiatry department at Harvard. At the same time, the executive secretary for the president of the University of Miami had a son who was one of our first patients here. What we've done over the years is to move from training that workforce to developing workforces that could work in interprofessional ways. And so when we look back at the history of the center, it's been a phenomenal ride. It was about research. Our early work using little vests that would allow children to feel speech. Well, that evolved into a technology of cochlear implants, and today our collaboration with the Children's Hearing Institute and the Department of Otolaryngology and the Debbie School is really providing technological care to help children be able to hear, and then through the Debbie School providing them with opportunities. More than 30 years ago, the Debbie School was working on inclusion. We have more than 145 children on our waiting list to get into the inclusion school. So one of our future projections is how can we help child care centers be able to replicate what we do. When we started 50 years ago, most of the children we saw, there was a genetic basis for their disability. And then we began to recognize through the infant health and development study to include children who were premature. And that focus expanded. We've done work in the areas of chronic illness, children with diabetes and cystic fibrosis. We've been able to work and influence treatment protocols in cancer, in HIV. We've been part of the development with Dr. Scott's work here, and even today we're doing work looking at the effects of general anesthesia on a child's brain, and now today we're beginning to think about the effects of early trauma exposure. We've done work on effects of substance abuse and really looking at the effects of that long-term in a lifespan perspective. Our latest work has been in evidence-based care for mental and behavioral problems using parent-child interaction therapy. We have developed and intentionally looked with community partners to brainstorm together to solve these problems so that again, the capacity of our communities are developed. Today, we are able to train about 100 advanced trainees in fields like developmental pediatrics and psychology, audiology, speech and language pathology, ethics, health administration, social work. And those individuals not only learn the skills of their discipline, but they learn how to work with the other disciplines to create synergy. We've also been impactful. Our work and our training has really focused on addressing the needs of the underserved. The population of children who are able to gain access to our services, our programs here, about 80% of them are children from minority populations, underrepresented areas, or children who live in some level of poverty. We're serving 15,000 children. That's not enough. Now, as we're moving into our next half century, we are now looking to how can we bring evidence-based services to increase the access? And by doing that, can we use technology? A big part of what we need to be able to do as an academic center is develop best practices and then share those, train partners in the community so that children can get those services close to where they live at really high quality and impact nationally and globally. We're so pleased to be able to celebrate 50 years.
Happy birthday to you. Happy birthday to you. Happy birthday, Mailman Center. Happy birthday to you.
Feliz cumpleaños.
We're blessed to be part of this community, to be part of this university, and we are blessed by the people who have committed their lives to making this one of the places that really improves lives.
Through
innovation,
impact,
and connection.
what is next?